Thanks to the development of modern dental technology, many teeth, which were so far deemed untreatable, nowadays may be cured. Patients' requirements grow constantly. First of all, they want to keep their own teeth, and therefore they very unwillingly decide to extraction and prosthetic replacements. Today there is a chance for saving the tooth which pulp was infected by bacteria and their toxins. It is given to us by endodontology, the branch of dentistry still closely associated by patients with painful and long-lasting treatment procedure. Have you ever received root canal treatment? Yes, once. And how long did it take? Some time. I remember visiting my dentist 3 times. The treatment was divided in 3. First, the doctor devitalized my tooth. Later, we proceeded slowly to the finish. But I think usually it took 3 visits to cure the tooth. You know, it depended on how many root canals were treated. If 3, then it took some time. If 1, it was not so long. Drilling, cleaning the root canal, removing the nerve, and the whole procedure was repeated several times. And how long did it take? Well, quite long. Oh my, 2, 3 times. Endodontology is the branch of preventive dentistry concerned in root canal treatment. Simplistically, it consists in the mechanical and chemical removal of infected or necrotic pulp from the tooth chamber and root canals, and in the end, in their obturation. Thanks to great advance of knowledge, as much as great development of technology, that last one may be even more than the first, nowadays potentially each and every tooth may be treated endodontically.
Potencjalnie przede wszystkim każdy ząb można leczyć endodontycznie. Dawniej raczej ograniczono to.
Not so long ago, this possibility was limited to the anterior teeth only. In some cases, when talking about posterior teeth, we treated only chosen root canals, the ones easier to reach. But now, thanks to the mentioned progress, all the teeth, including even the 8th one, called wisdom tooth, can be subjected to root canal treatment. More professionally, we say endodontic treatment, and thus can be preserved in the oral cavity without any surgical operations.
I może być utrzymany w jamie ustnej bez żadnych zabiegów chirurgicznych. Pacjent, który przyjdzie.
Patient who is suffering pain comes to the doctor and has the tooth completely cured during one visit, and this includes even final filling of the cavity.
Wypełnieniem ubytku.
All that is possible thanks to specially created and constantly improved endodontic devices. They allow to remove the inflamed pulp precisely and gently and to shape the root canal correctly, what guarantees the firm obturation without micro-leakage. Mechanical shaping and cleaning of a root canal system is supported by an abundant rinsing with chemical fluids. The aim of using them is to disinfect and consequently to help cleaning the whole root canal system. All the procedures during the endodontic treatment should be conducted in the full isolation from the excess of saliva, so that the result of the therapy could be effective and long-lasting. To preserve patients' safety, the dentist uses cofferdam. It is a special latex covering that helps to protect the whole oral cavity during the treatment. It is very important to prepare the root canal system on its whole length. The doctor may precisely measure it with endometer. The device uses the effect of various electric conductivity of tissues found inside and outside the tooth. Thanks to endometer, also pregnant women may have correct treatment performed. Because of the harmfulness of X-rays, so far it had to be put aside till after the birth of a child. The appliance of modern radiological systems and the use of dental microtomographs reduced the radiation dose to the minimum. Thanks to that device, we can also control our work, taking more pictures with lower dose of radiation. An inappreciable support in the endodontic treatment is provided by surgical microscope. Thanks to this device, dentist performing treatment may localize small and often hardly visible hidden root canal orifices and precisely shape and clean the whole root canal system. When using the surgical microscope, he is able to look deep inside the root canal and perform treatment accurately. The doctor performing root canal treatment has a very small operating field. Thus, working with enlargement gives a magnificent advantage. It allows to improve the quality of the treatment and its predictability.
Przewidywalność naszego leczenia.
Zęby różnią się między sobą.
The teeth differ between themselves with the number of root canals, their shape or length. It happens very often that there are also additional accessory canals that we cannot see without enlargement. If we don't localize and thoroughly treat them, the result may be infection or inflammation causing pain, and that usually leads to extraction. When working with enlargement, the dentist can be sure about the results and final success, preserving the tooth for many years, which is exactly what patient requires.
Na wiele, wiele lat.
After shaping, cleaning and drying the root canal system, the dentist can start to fill it with proper materials. In most cases, the material used in this procedure is gutta perca. It may be applied cold, as a point put in the root canal with obturating sealer. The other way of using gutta perca consists in putting it into the root canal after warming it up and plastifying it. As a result, the dentist gets firmly obturated root canal system. Right now, the dentist can start rebuilding the tooth crown with filling materials or very often with prosthetic crown. The tooth treated this way has a chance to serve patient for many, many years. The endodontic treatment is very labor and time-consuming. It requires specialistic, expensive instrumentation as much as wide knowledge and skills. That's why it is not cheap.
Generalnie to leczenie nowoczesne jest...
In general, when talking about money, modern treatment is definitely more advantageous than traditional one. In the beginning it can seem a bit expensive, but on the whole it is cheaper. Mostly because traditional treatment is not so reliable and eventually it may lead to extraction anyway. Consequently, the missing tooth will have to be prosthetically replaced and that will generate further costs, etc., etc.
które znowuż będzie kosztować i tak dalej.
This shows that the use of aid provided by skilled and experienced dentists associated in Polish Endodontic Society is worth expenses.
Gabinety specjalistyczne oferujące...
One can easily find specialized surgeries that offer advanced endodontic treatment through the internet. On the official site of Polish Endodontic Society, www.endodoncja.pl, there is a lot of useful information. There is a part designed for dentists as well as a part meant for patients looking for advanced treatment that cannot be obtained in traditional surgeries which doesn't specialize in endodontology.
Stosowane w zwykłych gabinetach nie specjalizujących się w endodoncji.
To, że wstąpiłem do Towarzystwa Endodontycznego,
Joining the Endodontic Society let me develop my skills in this domain. First of all, it allowed me to look at the treatment from different point of view.
do tej pory
So far, and saying this I mean my 23 years long practice, I worked using, let's call it, traditional methods of root canal treatment. Multi-stage procedures, working almost blindfolded.
czyli wieloetapowe leczenie, pracowanie praktycznie po omacku.
When I got to know more about modern endodontology, the amount of surgical extractions that I performed decreased practically by 80%. Today I do much less extractions, that is, tooth removals, than I used to.
Często ekstrakcji, czyli usunięcia zębów, tak jak do tej pory to wykonywałem.
It is sometimes astonishing that people could develop root canal treatment so efficiently.
Tak skutecznie leczenie kanałowe.
Zauważyłem, że pacjenci coraz większą wagę przykładają.
I noticed that patients attach great importance to treatment, including root canal treatment, and realize that properly cured tooth is a very valuable one. Many times we meet the situation where general stomatologists, who are not prepared to perform proper root canal treatment, refer patients to us. Why is it so important to think twice before one decides to treat the tooth endodontically or just to extract it? The extraction doesn't solve the problem. Real troubles show up later. Missing tooth needs to be replaced prosthetically with a bridge or surgically with an implant, and that is really expensive. Moreover, given the replacing up may cause opposing teeth to slip out, adjoining teeth to move and turn, or even result in bone atrophy, what consequently may lead to further extractions. Missing teeth may also cause changes in the area of the temporomandibular joint and deprive chewing. Considering all the costs and threats raising from the decision about extraction, the possibility of saving bad teeth that is given to us by modern endodontology is a great achievement of today's dentistry.